The ASHP Research and Education Foundation, in partnership with the Cardinal Health Foundation, is pleased to present the 2011 Award for Excellence in Medication Use Safety. This award, the only one of its kind, honors health system pharmacists who exercise leadership that results in interdisciplinary teamwork, innovation, and improvements in medication safety. The 2011 Award for Excellence in Medication Use Safety goes to UW Health, the University of Wisconsin Hospital at Madison. In the fall of 2009, UW studied its rate of inpatient venous thromboembolisms and outpatient anticoagulant use.
We felt that organizationally was an area we had some gaps and some opportunity from the pharmacy perspective to provide a leadership role.
Led by the pharmacy department, UW Health convened an interdisciplinary team to improve VTE prevention and anticoagulant use across the health system.
You start with the guideline. Start with what your organization believes is the best way to care for patients, and then say, well, now that I know that, what's next?
The group designed the Anticoagulation Stewardship Program, potentially impacting up to 1 in 4 hospital inpatients and 3,000 outpatients in 33 of the health system's clinics.
We wanted to tie in both inpatient and ambulatory, so we wanted to make sure that this program was going to cover all UW Health and not just focus on one specific patient population.
With its broad scope, the program was as ambitious as it was innovative, especially given the challenges of anticoagulation management and the high-risk conditions it is designed to prevent.
And any of those stroke-type symptoms we always ask about, slurred speech, terrible.
The new program provided multiple solutions across the health system that would allow all providers to access the expertise of pharmacists, even when a pharmacist could not actually be present.
We wanted to almost be able to replicate what would a pharmacist do in this situation.
The team designed and implemented clinical decision support, monitoring tools, and education programs for frontline providers. To start, hundreds of order sets were changed to ensure that physicians had information about evidence-based VTE prophylaxis at their fingertips.
We can't obviously dictate to physicians how to manage their patients, but we can lay out for them the evidence in the literature on what the best practice would be from our interpretation of it.
Likewise, rounding pharmacists were provided with tools to assess whether patients were receiving optimal therapy. The resulting improvements were impressive. The percentage of medical inpatients receiving no VTE prophylaxis declined from 24% to 8%. Among surgical inpatients, there was a comparable decline from 20% to 3%. Post-operative VTE events were reduced by almost half, from 11.6 to 6.6 per 1,000 cases. These reductions in VTE events are estimated to have saved over $1 million in healthcare costs.
My name is Anne, I'm a pharmacist.
At discharge, patients are now provided with clear, standardized education, and the transition from inpatient to outpatient care is facilitated through an electronic health record. In the 33 ambulatory clinics, nurses care for patients taking warfarin, but not assigned to an anticoagulation clinic. The nurses use standardized patient assessment questions developed by the pharmacist-led team. Based on patient responses and their INR values, the nurses can then access evidence-based guidance for dosing adjustment.
I know the abilities of the RN staff, and I think it's a great way to utilize them to their full potential.
Before the changes were implemented in the outpatient clinics, the medical staff documented patients' target INR values 77% of the time.
I have your INR results today.
Now, with the staff following standardized procedures, target INRs are documented 97% of the time. This has resulted in better warfarin management. Today's patients are within therapeutic INR range 73% of the time, a 9% increase from the pre-program baseline.
It was really the first time in our health system that we've ever been able to standardize something as complicated as warfarin in dozens of clinics, dozens of care settings with dozens of providers, and do it in a way that didn't cost the organization much money in terms of investment of resources.
I believe our pharmacy department leads our organization in innovation and new ideas and cost-saving measures. It's just an unlimited source of ideas for the organization going forward.
For its pharmacist-led teamwork, developing an anticoagulation stewardship program that is unique in its scope and system-wide outcome improvements UW Health is honored with the 2011 Award for Excellence in Medication Use Safety.